Bismillahirrahmanirrahim. Our lecture title is Nomenclature of Tumors. Here we must know well how to choose the name of the tumor. We will go through the nomenclature of the tumors and give you examples of many tumors and how to choose the name of the tumor. First of all, we will provide you some case scenarios to make the condition very clear. First, the patient A, we have a 70-year-old man admitted to the hospital with a history of constipation, abdominal distension of 6 months duration. He had noticed blood in the stool. Sigmoidoscopy showed a growth here, a growth in his sigmoid colon. So first of all, we will take the growth, okay? And the biopsy diagnosis was colorectal adenocarcinoma. So we have adeno and carcinoma. We will discuss it in detail, inshallah. And sigmoid colectomy was done. Sigmoid colectomy was done. As you see in this photo, the tumor, the arrow points to it. It is an ulcerated growth. There is an ulcer. We call it tumor or neoplasm. Tumor or neoplasm. In this patient, 1 year after the operation, he developed the pain in the right hypochondrium associated with severe loss of appetite. A CT scan was done and showed multiple tumor deposits. Here, as shown in the photo, there are multiple nodules, multiple deposits within the liver. And these deposits, we call it metastasis. Metastasis. And we will discuss in details what's the meaning of metastasis, what's the meaning of the tumor, what's the meaning of carcinoma, what's the meaning of adeno, etc. Then the patient died after his diagnosis. The second patient is a 45-year-old woman admitted to the hospital with a history of excessive menstrual bleeding of 3 months duration. A CT scan showed that she had multiple tumors in the uterus, and the hysterectomy was done. And the pathological examination of the uterus showed that these tumors were leiomyomas. Okay. She made an event for recovery after the operation. Here the uterus, and the uterus showed multiple tumors, multiple neoplasms. Okay, these multiple tumors in the uterus, the arrows point to. So we have 2 patients, and the 2 patients, the first and second patient, both of them had new growth. We call this growth a tumor or neoplasm. A tumor or neoplasm. So tumor means neoplasm. Why it's important to learn about neoplasm? First of all, the neoplasm is a mass of abnormal tissue formed as a result of excessive, inappropriate, purposeless proliferation of the cell. So, the neoplasm, a mass of proliferating cells, is a mass of proliferating cells, and these cells have no function and harmful to the patient. It's harmful. And the neoplasm, we subclassify neoplasm into benign neoplasm and malignant neoplasm. What is the meaning of benign and what is the meaning of malignant? Benign neoplasm is a neoplasm that remain localized. There is no infiltration or invasion of the surrounding tissue. And this tumor can be easily excised, can be easily removed. And the rate of growth of this benign tumor is slow. And these tumors don't spread. No distant metastasis in benign tumor. So benign tumors remain localized without infiltration of the surrounding or without sending distant metastasis. However, malignant tumor is a very aggressive tumor that invades the surrounding tissue, grows rapidly, difficult to be excised, and spread to distant metastasis via blood or lymphatics. And this photo shows that benign tumor well circumscribed without infiltration of the surrounding, while malignant tumor is ill-defined, not circumscribed, and infiltrates the surrounding. Also, the benign tumor send distant metastasis the benign tumor does not send distant metastasis, while malignant tumor send distant metastasis. So what's the meaning of metastasis? This is a secondary deposits. This is tumors discontinuous with the primary tumors. So these deposits, they are tumoral proliferations that are discontinuous with the primary tumor. So when the primary tumor sends metastasis, it spread through blood or lymphatics and go to other organs. And in these organs, they proliferate producing new tumors. So these tumors which are produced in these distant sites are discontinuous with the primary one. The tumors are composed, any tumor is composed of two elements. So the parenchymal component and the stromal component. The parenchymal component is the main component of the tumor, which is very essential for the character of the tumor. So parenchymal component is the proliferating part of the tumor. So the cells which proliferate is the parenchymal cells, while the supporting stroma serve the proliferating parenchymal tumor by supplying blood supply, nutrition, etc. And the nomenclature is based on the proliferative part of the tumor in the parenchymal part, of the tumor. So nomenclature of the tumor is based on the proliferative part of the tumor. So tumors nomenclature, we give the name to the tumors according to histogenetic component or behavioral component. Behavioral component, as we said before, the tumor is benign or malignant. What about histogenetic component? So the tumor arises from epithelial or mesenchymal. And which type of epithelium? Is it surface epithelium, glandular epithelium? Also, there is this arises from connective tissue or mesenchymal tissue. So the histogenetic component depends on the tissue from which it arises, either epithelial or mesenchymal. Okay. So the tumors either arising from the epithelium or from connective tissue, and each one is subdivided into benign and malignant. Benign tumors. So most benign tumors, when we give name to a benign tumor, we add the suffix "oma". So the suffix "oma" is added to the tissue of origin to name the benign tumor. For example, we call it adenoma. Adenoma. So aden means glandular epithelium. Oma, mass, swelling. So any tumor arising from glandular epithelium, we call it adenoma. So aden is glandular epithelium, oma, swelling or tumor. So any benign tumor arising from glandular epithelium or glandular structures, we call it adenoma. What's called papilloma? Papilli means finger-like projection. Finger-like projection. So if there's finger-like projection, so these are tumors arising from surface epithelium. Either skin or the surface epithelium lining in any hollow organ. So called papilloma. So the benign tumor arising from the surface epithelium producing finger-like projections or papillary process. Cyst adenoma. So as we said before, aden, glandular epithelium, oma, swelling. So a benign tumor arising from glandular epithelium. But this tumor produce cyst. So we call it cyst adenoma. So it is adenoma, but with cyst formation. This example of adenoma and the papilloma of the colon. So there is finger-like projections here arising from the colonic epithelium. We call it papilloma. And also we can call it adenoma because the epithelium here is glandular epithelium, because mucus secreting glandular epithelium. Oh, here this is thyroid gland on the left one, thyroid tissue. Is a benign tumor arising from thyroid tissue called thyroid adenoma. On the right side of the photo, there is finger-like projection. Finger-like projections, we call it papilloma. This is an adenoma, but with cyst formation, we call it cyst adenoma. So here we can add the site of origin to the benign tumor. We call it this adenoma. When it arises from the thyroid, we call it thyroid adenoma. Arising from the colon, we call it colonic adenoma. From the liver, we call it liver cell adenoma. Also papilloma, if arising from the squamous epithelium, we call it squamous cell papilloma. If arising from the transitional epithelium of the urinary system, we call it transitional cell papilloma. Okay. Also, we can add oma to the cell of origin. To name the benign tumor of connective tissue. So to name the mesenchymal tumors, we add the suffix oma to the cell of origin. So hemangioma, benign tumor arising from vascular space. So from blood vessels, hemangioma. Lipoma, benign tumor arising from fat cells, lipocyte. We call it lipoma. Chondroma, benign tumor arising from chondrocyte, cartilage. Fibroma, benign tumor arising from fibrous tissue. Leiomyoma, benign tumor arising from smooth muscle. We call it leiomyoma. The photo on the left is lipoma, which is yellow in color, circumscribed as any benign tumor. Must be circumscribed, no infiltration, no invasion, no distant metastasis. On the right side, there is multiple benign smooth muscle tumors within the uterus. We call it leiomyomas, as you see in multiple tumors here in the uterus. The benign tumors may have mix of epithelial and mesenchymal element. We call it mixed tumor. And an example of the mixed tumor, there is fibroadenoma. So there is fibro, there is proliferation of fibrous tissue, fibro, and adenoma, there is proliferation of glandular epithelium. Oma, benign tumor. So there is mixed proliferation of the epithelial, glandular epithelium of the breast and the fibroblastic component of the breast to produce a mixed tumor. So here the mixed tumor contains two proliferating components, epithelial and mesenchymal, and you call it fibroadenoma. Malignant tumors. So malignant tumors, we have the malignant tumors may affect the epithelium or may affect the mesenchymal tissue. Malignant epithelial tumor, we add the suffix carcinoma. Carcinoma. So if there is a malignant tumor arising from the glandular epithelium, we call it adenocarcinoma. The benign tumor of glandular epithelium, we call it adenoma, while the malignant tumor of glandular epithelium, we call it adenocarcinoma. Also, squamous cell carcinoma. Squamous cell carcinoma. Malignant tumors arising from squamous epithelium. Benign tumor arising from squamous epithelium, we call it squamous cell papilloma. Transitional cell carcinoma. This malignant tumor arising from transitional epithelium of the urinary system. Transitional cell papilloma is a benign tumor, while transitional cell carcinoma is a malignant tumor. Sometimes we add the adjective, an adjective as well. How? If we have a tumor composed mainly of cells with clear cytoplasm, we call it clear cell carcinoma, like those of the kidney, clear cell carcinoma. If I have a malignant tumor in the thyroid and we produce multiple papillae, we call it papillary carcinoma of the thyroid. So this we describe the tumor as we are describing the tumor. It's called papillary carcinoma. The cholangiocarcinoma, this malignant tumor arising from the bile ducts and gallbladder. Cholangiocarcinoma. Also it affects the liver. Malignant connective tissue tumor. If here in the malignant epithelial tumor, we add the suffix carcinoma, while in malignant connective tissue mesenchymal tumors, we add the suffix sarcoma. So, if a malignant tumor arising from the chondrocytes or from the cartilage, we call it chondrosarcoma, while the benign tumor arising from the chondrocyte we call chondroma. So, chondroma benign tumor, chondrosarcoma malignant tumor arising from chondrocytes, and so on, fibrosarcoma, liposarcoma, osteosarcoma. There are some exceptions to these rules of nomenclature. Neoplasms that sound benign but really malignant. Lymphoma, here the suffix oma doesn't mean benign tumor. So a lymphoma, malignant tumor of lymphoid tissue. Malignant tumor of lymphoid tissue. Here there is an exception. There is an exception. Melanoma. Also here we have this suffix oma, but it is not a benign tumor. It is a malignant tumor of melanocytes. Hepatoma. Also hepatoma, oma, doesn't mean benign tumor, but hepatoma is a malignant tumors arising from hepatocytes. Glioma, glial tissue of the brain. So when the tumor arising from the glial tissue doesn't mean benign tumor. Okay, these are the exceptions. So there are some exceptions to the suffix oma, which doesn't mean benign tumor but means malignant tumor. Leukemias are neoplasms of blood-forming cells, malignant neoplasms of blood-forming cells. And we are classify them according to the course, acute or chronic, and according to the cell of origin, either lymphocytic, myelocytic, and monocytic. There are neoplasms arising from totipotent cell. What's the meaning of the totipotent cell? A totipotent cell is a cell that are capable of differentiation into any type of cell in the body. So in the postnatal life, only totipotent cells present in the postnatal life is germ cell. So germ cell, the only totipotent cell remains in the postnatal life. So what is the meaning of totipotent? Cells have the capacity to differentiate to any type of cell in the body. So we have totipotent germ cell may be transformed into neoplastic germ cell. And if the neoplastic germ cell has no differentiation, it remains the same, no differentiation into other type of tissue, we call it undifferentiated. Okay, so it retains germ cell characters like seminoma in the testis and dysgerminoma in the ovary. So seminoma and dysgerminoma. Also here there is exception. Oma in the seminoma, it doesn't mean benign, it means malignant tumor. Also, dysgerminoma in the ovary is a malignant tumor. So it's a malignant tumor arising from totipotent germ cell without differentiation. Okay, when there is differentiation, the differentiation may be minimal epithelial differentiation. The differentiation may be minimal, like this we call it embryonal carcinoma. But if the differentiation is extensive differentiation, there is differentiation along somatic differentiation. What that means, somatic differentiation? There is differentiation along the all tissues arising through the all three embryonic germ layers. It may be mature tissue or immature tissue. We call it teratoma. So teratoma is a tumor arising from neoplastic germ cell with somatic differentiation. If the differentiations occur along the pathway of trophoblast, there is trophoblastic differentiation, cyto and CC trophoblast. The tumor arises from this difference called choriocarcinoma. So a malignant tumor arising from neoplastic germ cell with trophoblastic differentiation. It may differentiate along yolk sac differentiation. We call it yolk sac carcinoma. The term cancer here, we should look at the term cancer that any malignant tumor, we call it cancer. Any malignant tumor, we call it cancer, whether epithelial or mesenchymal or arising from germ cell. Okay, we call it cancer. The neoplasm is a broad term, include benign and malignant. Neoplasm include benign and malignant. Also tumor is a broad category, include benign and malignant. So to differentiate between benign and the malignant tumor, as we said before, well-demarcated masses is a benign tumor, while ill-demarcated infiltrated masses is a criteria of malignant tumor. So benign tumor, there is no infiltration of the surrounding tissue, no invasion of the surrounding tissue, while malignant tumor infiltrate and invade the surrounding tissue. Benign tumor may be encapsulated, but malignant tumor usually non-capsulated. So encapsulated tumor can be easily removed, can be surgically enucleated, while non-capsulated malignant tumors is very difficult to be surgically removed. So, also malignant tumor may arise from pre-invasive or carcinoma in situ stage. Malignant tumor, before it invade, it first produce carcinoma in situ in the place of the epithelium. Then after occupying the whole thickness of the epithelium, it started to invade to the underlying tissue. So malignant tumor may arise from a pre-invasive or carcinoma in situ. May arise from a pre-invasive or carcinoma in situ stage. Okay. This is an example of malignant tumor of the bone. We call it osteosarcoma. So sarcoma is a malignant mesenchymal tumor. Sarcoma. Osteo arising from osteocytes or osteoblast. We call it osteosarcoma. See here, the osteosarcoma infiltrates the surrounding. It infiltrates the surrounding tissue. It grows beyond the bone. Also, benign tumor, as we said before, every tumor has a parenchymal component and stromal component. The parenchymal component is the proliferating part of the tumor. The stromal component provides blood supply and nutrition for the tumor. So in the benign tumor, the stromal component contain well-formed blood vessels. So the blood vessel well-formed, that means composed of endothelium, basement membrane, and all of them are well-oriented and mature. Okay, but in the malignant tumor, there are ill-formed blood vessels. It may lack endothelial, lack the basement membrane, but they are numerous. They are numerous. So the number of blood vessels in malignant tumor more than that of benign tumor, while the blood vessels in benign tumor are well formed. However, in the malignant tumor, they are ill formed. Benign tumor necrosis and degenerative changes are unusual because it grows slowly and have blood supply sufficient to maintain them. But malignant tumor grows rapidly and exceeds the capacity of the blood supply. So there is necrosis and hemorrhage in the malignant tumor. Necrosis because the blood supply can't provide the nutrition, sufficient nutrition, sufficient requirements for the proliferating cells, so the cells will be necrotic. Also, there is hemorrhage because the blood vessels here in the malignant tumors are ill-formed, so they can rupture easily and the hemorrhage is produced. So an example here is you see the malignant tumor in the liver on the right side, hepatocellular carcinoma, or other name hepatoma. Hepatoma or hepatocellular carcinoma, both nomenclature, we use both names for malignant tumors arising from hepatocytes. It's called hepatocellular carcinoma or hepatoma. Here you see the dark red spots, which mean there is hemorrhage. There is extensive hemorrhage in the tumor, and also on the left side, we show renal cell carcinoma. There are extensive necrosis, which is yellow in color. Coming to differentiation, What's the meaning of differentiation? It is the degree of resemblance of the tumor cells to the normal cells. So if I have malignant tumor arising from the liver, if the malignant cells resemble that of normal cell, we call it well differentiated. If not, it is undifferentiated. So the differentiation at both morphologic and function element. So there is this neoplastic cell, diagnostic cell. If it looks like normal cells morphologically and functionally, we call it well differentiated. If they are completely different from the normal cell, we call it undifferentiated. Benign tumor, all benign tumors are well differentiated. So they closely resemble the normal cells from which they arise. Malignant tumors have maybe well differentiated, moderately differentiated, or poorly differentiated, or undifferentiated at all. So the malignant tumors have range of differentiation, either well, moderate, poor, or undifferentiated. And the function of malignant cells are abnormal function. Abnormal function. So here in this photo, we show lipoma. So lipoma is a well-circumscribed tumor, yellow in color, looks like fat. Also, the cells here are well differentiated. They resemble fat cells. Leiomyoma, the benign tumor arising from smooth muscle, and these are well differentiated because the cells of the tumor resemble that of the normal cells. In the thyroid adenoma, there is a benign tumor formed of thyroid follicles, looks like normal thyroid follicle. So it is well differentiated. So all benign tumors are well differentiated. While malignant tumors have a grade or have range of differentiation, either well differentiated, moderately differentiated, or undifferentiated. Also, we have certain criteria for malignant cells. So certain criteria of malignant cell, we call it cellular atypia or anaplasia. First of all, the first criterion is heliomorphism. Heliomorphism, there is variability in size and the shape of the tumor cell. So variability in size and shape of the tumor cells, we call it heliomorphism. The second, the nuclei are enlarged so that the nucleocytoplasmic ratio will be increased. The normal is 1:4 or 1:6, while in malignant tumors it may reach 1:1. So the nucleocytoplasmic ratio is increased. Nucleocytoplasmic ratio means the size of the nucleus in relation to the size of cytoplasm. Also, the chromatin of the nucleus is coarsely clumped. There is hyperchromasia. There is increased amount of chromatin. And the nucleoli are large. There is prominent nucleoli. Also, we may find tumor giant cells who have large cell and they may contain multiple nuclei. And the difference between benign and malignant tumors, also in considering mitotic figures. Mitotic figures are rare in benign tumor because it slowly grows slowly, and the division is very slow. So we will find mitotic figures, very rare mitotic figures may be seen, while in malignant tumors as they grow rapidly, there are multiple mitotic figures, and the mitotic figures are numerous and abnormal. On the left side you can see the normal mitosis, but on the right, which is abnormal, may produce X-shaped or Y-shaped abnormal mitosis. Here in this photo, the normal mitosis, this is the on the left, as you see, while X-shaped or multiple arms of the chromosomes, we call it abnormal mitosis. So the DNA content in the benign tumor is usually normal, but it is increased in the malignant tumor, so there is aneuploidy or polyploidy. Karyotype is usually normal, but in the malignant tumor, there is multiple mutations. There is chromosomes, there is addition of chromosome, deletion of chromosome, translocation, multiple mutation in malignant tumors. Thank you very much. Assalamu alaikum.